Hi, my name's Carly Norwood, and I've had the incredible privilege of serving as the team lead for the Oklahoma Funding Accelerator Team this semester. OFA has been hard at work this semester and through early morning meetings and gaining an extensive knowledge about mulch and aesthetic injectables that we never thought we'd have, the team has been able to make a huge impact on their clients. This definitely wouldn't be possible without help from several different individuals. First, the 4 consulting associates, Calla Hamlin, Taylor Finley, Jarrett Ferguson, and Tim O'Sheridan, have been able to make an incredible impact this semester. It's been so great to watch them grow and see what they can do for their clients. Next, thank you to our clients, Skin Lab Injectables, the Norman Compost Facility, Castle, and Stephenson Cancer Center for allowing us to work with you. And last but certainly not least, thank you to the I-CCEW staff, specifically our fellow Michael Rath, for all your help this semester. We definitely wouldn't have made it this far without you. I'm so excited to welcome the OFA team to the stage, and please help me welcome them.
We are the Oklahoma Funding Accelerator Team. OFA operates a little differently than the other teams in the sense that we do not work all together on one project, but rather we have 4 individual projects where we are each consulting one-on-one with the small business in order to help it solve any problems it is currently facing. Our team lead is Carly Norwood, and our fellow is Michael Rath. My name is Calla Hamlin, and I'm a sophomore from Flower Mound, Texas, studying entrepreneurship and marketing, and my project is Skin Lab Injectables.
My name is Taylor Finley. I'm a senior entrepreneurship and pre-law studies major from Perry, Oklahoma, and my client is the Stephenson Cancer Center.
My name is Jarrett Ferguson, and I'm a senior entrepreneurship and finance major from Norman, Oklahoma, and my client is Castle.
And I am Timothy Sheridan, and I'm a senior economics major from Vienna, Virginia, and this semester I was consulting with the City of Norman Compost Facility.
Skin Lab Injectables is a locally owned medical spa facility that specializes in administering aesthetic injectables like Botox to help clients look and feel their best. Founded in 2015, Skin Lab has come a long way from conducting mobile house parties to having 2 brick-and-mortar locations in the greater Oklahoma City area. This semester, I've worked closely with Skin Lab's owner, Sarah Bleakley, to help her answer the question, how can Skin Lab grow? I've broken my research down into 3 main questions. 1, what current accessible funds can Skin Lab contribute towards growth? 2, how can Skin Lab increase its overall revenue? And 3, how can Skin Lab grow to a 3rd location? Through my research, I've discovered that the best answers to these questions involve bootstrapping current operational funds, as well as implementing growth strategies that focus on customer retention and product diversification in order to grow to a 3rd location. With that being said, Skin Lab needs to save approximately $219,000 in order to open a 3rd location in Broken Arrow, Oklahoma. This is an ideal location because it is a suburb of Tulsa that is wealthy, highly populated, and has plenty of room for growth in the medical spa sphere. Over the course of 15 months, Skin Lab can save up enough for this 3rd location with allocations from current operational funds, as well as by implementing a loyalty program and by offering laser treatments. Now, whenever people are going to get Botox, they typically prefer to actually trust the person that's going to be coming near their face with a needle. With that being said, Skin Lab employs highly experienced and trustworthy injectors that allow them to enjoy high customer retention rates. They can further increase these rates by implementing a tier and point-based loyalty program that will increase their profits by $96,000. Now, this research is based on a few key assumptions. First, in 2016, Skin Lab served approximately 2,400 customers. For the sake of my research, I kept this number constant. Next, from this customer base, about 13% is loyal all of the time, while only 29% is loyal some of the time. Based on these statistics, Skin Lab can expect to receive about 1,000 customers willing to sign up for this loyalty program. Now, due to the fact that this is an incentivized program, roughly 700 semi-loyalists would be willing to schedule at least 1 additional appointment over the course of a year at a discounted price. Armed with the knowledge that each typical appointment costs the customer $250, Skin Lab can generate an additional $218,000 over the course of 15 months, leaving $96,000 in additional revenue. Next, SkinLab should rent out one IPL Harmony laser machine from the Laser Partners of Oklahoma for one event day that costs $1,100 a day for each month from October through March, when sunlight exposure would be limited for patients. Armed with the knowledge that each treatment costs the customer about $300, and understanding that SkinLab can maintain 15 clients each of these event days, they can generate an additional $25,000 in profit each over the course of 15 months. Lastly, after my presentation, I will be handing SkinLab a set of detailed guidelines for allocating current operational funds, as well as a cost and benefit analysis for the previous growth methods that I mentioned, and lastly, a list of ideal opportunities for locations for their third store. And now Taylor will tell you more about Stephenson Cancer Center.
Thank you, Kala. Stephenson Cancer Center is located in Oklahoma City, right on OU's Health Science campus. Stephenson is currently a state leader in cancer care, as they're the only comprehensive academic care center in the state of Oklahoma. This semester, the Director of Operations and former I-CCEW intern, Ben Icard, has tasked me with implementing strategies to help reduce costs for patients. So this semester, I've been looking at three main questions. The overall question is, how can Stephenson reduce costs for patients? More specifically, what programs should Stephenson invest in on behalf of the patients? And lastly, what value will these investments bring to the patients? Going forward, Stephenson should focus in on the case management aspect of social work by hiring 7 more social workers. By doing this, patients will have improved quality of care, and they will also have reduced financials. Right now at Stephenson, there are about 21 different roles assigned to helping the patient experience, whether those roles range from financial navigators to patient navigators or social workers. Stephenson should focus in on the social workers because they have the capacity to sort through all patients and then send them to the appropriate department based on their needs. Right now, the social work department at Stephenson only has the capacity to look at 37% of all patients, leaving a 63% gap. Going forward, Stephenson can add more social workers and achieve 100% patient coverage. However, after looking at different studies done in New York on breast cancer centers, out of all the patients screened, usually about only 85% need actual case management. However, there still needs to be that 100% coverage to assess that 85%. If Stephenson chooses to invest in the social work department, patients can save a lot of money. Right here, patients A and patients B are both patients at Stephenson who were able to save thousands of dollars in just 1 year of treatment because they had access to a social worker. So these patients were saving on housing, different gas, transportation, and on third-party financial assistance. Stephenson there's great cancer centers in the world. In this semester, I identified MD Anderson as the ideal benchmark after looking at several different ones in the United States. MD Anderson currently has a great social work department, and Stephenson can learn some key takeaways from MD Anderson. The first deals with having a proactive system. So right now at Stephenson, not all patients know that they have access to a social worker. So going forward, we can make sure at Stephenson that there's about 2 to 3 different social workers in each clinic and that they're overseeing multiple clinics. This can ensure standardization, coordination, and it can eliminate the need for hiring an overall director. Second, Stephenson can improve the awareness aspect of social work by making sure that all patients are aware that they have a social worker, whether this is by an informational pamphlet or by having a one-on-one consultation. And lastly, Stephenson can ensure active screening by making sure that they're implementing surveys upon this initial consultation. That way they can assess patients' needs and then connect them to the appropriate department. Right now, Stephenson is participating in the oncology care model, which is done through Medicaid. So what this means is that for each Medicare beneficiary that comes through Stephenson, Stephenson gets money to invest in enhancing the patient experience. The model lasts for approximately 5 years, and at the end of each year, Stephenson gets about $360,000 to invest. The only stipulation for these investments is to make sure that Stephenson uses these funds to invest in enhancing the patient experience. Stephenson should use these funds to invest in 7 more social workers. That way there will be 11 in total. Each will oversee roughly 1,200 patients, ensuring 100% coverage. So going forward, I'll be giving Stephenson a cost-benefit analysis with new changes, as well as an active screening survey that they can implement, and a tour, an online training course that their new social workers can go through. And now Jarrett will speak with you about Castle.
Thank you, Taylor. Castle is an online and mobile property management app that provides an investor-driven analysis of the properties they own, places tenants in their vacant properties, and provides services for maintenance requests. Their current operations are based out of the Southeast Michigan or Greater Detroit area, where they have about 600 units under management. The Chief Technology Officer, co-founder, and my main point of contact for this project, Scott Lowe, is a former I-CCEW intern and team lead himself. This semester, I was tasked with determining what kind of partnership is best for Castle to pursue to expand its units under management. I broke down my research into three main questions. First being what types of companies would be best for Castle to partner with. Second, what the structure of this partnership would look like. And lastly, how Castle should approach these potential partners. Ultimately, through my research, I found that implementing a realtor referral program with a $200 incentive fee to realtors can add 60 units in just the first 2 years of implementation. I started out by looking at the major types of companies that operate within the real estate space. And through my interviews with many different people at these types of companies, I found that there are regulations in place that make partnering with title companies and financing companies extremely difficult. Next, I looked at online realtors and real estate investment websites. Through my interviews with people at these types of companies, I found that there is little to no interest in partnering with property managers at this time. Lastly, in over 30 interviews with local realtors in the Southeast Michigan area, I found that partnering with local realtors is the most attainable partnership for Castle to pursue to expand not only its units under management from new clients, but as well as units under management expanding current clients' portfolios. This realtor referral program will start with a realtor referring a client to Castle by way of the form on the website. Castle will then sign up the client for property management, and during a year's time, Castle will then send 2 $100 installments after each 6-month period back to the realtor as the incentive fee. This is structured this way to ensure that value is received from the client referral before referral fees are paid out. The per client value to Castle of annually is $240. Taking into account the realtor fee paid out of $200, this yields a $40 value to Castle at the end of the first year. Taking this into perspective and looking at the current client acquisition cost of $786, this has the potential to save Castle $586 of client acquisition fees per client, and which will yield 29 additional months in profitability. I found that through my research, this program has the ability to add 60 units in just the first 2 years of implementation by reaching out directly to real estate brokerage companies to get their full support and advertisement to their realtors that are organized under them. After the end of this semester, I'll be giving Castle a list of realtor referral program guidelines, specific guidelines for it, and then a strategy to advertise this program, and lastly, a list of real estate brokerages that match up with Castle's area of service in the Southeast Michigan area. And now I'd like to pass it off to Timo to tell you about Norman Compost Facility.
Thank you, Jarrett. Mulch. It's all around us, lurking just beneath our feet. It's in our lawns, it's in our gardens, and it's all over OU's campus. But where does all this mulch come from? Well, hopefully soon the answer will be the City of Norman Compost Facility. The City of Norman Compost Facility is a solid yard waste recycling facility that takes in green and brown organic material, grass clippings, tree leaves, and tree limbs, and processes them into mulch and compost. It currently processes over 17,000 tons of material per year. This semester, I was tasked by my clients, Ken Comiskey and Brett Scoville, the City of Norman's Utilities Director and the City of Norman's Solid Waste Manager, with finding ways to make mulch production at the compost facility more profitable. I broke my work stream down into 3 main questions. And the first was, what sort of product mix should the City of Norman pursue with its mulch distribution? I found that the City of Norman should split its mulch distribution between as-is sales and the production of filter socks. Filter socks are a product used for erosion control at construction sites. Next, I looked into what local businesses would be willing to pay for the mulch as is. And through interviews with local businesses, I found that most were willing to pay up to $2 per cubic yard. Finally, I looked into an investment in filter socks, and I found that the City of Norman can generate $75,000 in revenue in year 1 by investing in filter sock production, and that this investment can break even in the second year. Currently, the city of Norman produces approximately 30,000 cubic yards of mulch. The expenses associated with that mulch production are over $200,000. And at present, that mulch generates little to no revenue. If the city of Norman implements the recommended product mix, then the city of Norman can recover up to 1/3 of those expenses, which would represent $131,000 after the initial investment costs are taken into account. There are a few costs associated with beginning the as-is sales implementation. However, there would be a significant investment into filter socks. Filter sock manufacturing would require an upfront investment of approximately $40,000, and it would also require the city of Norman to hire one additional worker. However, it can generate $75,000 in year one revenue if the city of Norman can provide erosion control product for 50 work sites within the city. This investment is projected to break even in the second year. Moving forward, I'm recommending that the city of Norman begin the production of filter socks and also begin as-is sales to business buyers. And to help them with these steps, I will be providing them with validation for my pricing point, as well as a detailed investment plan in filter socks. And lastly, I will be giving them detailed survey data from over 350 Norman residents about their attitudes towards the compost facility. This concludes OFA's section of the evening. We will now open the floor to questions about any one of our projects. Yes.
My recollection is that currently I can go down and just my pickup truck and throw a bunch of mulch in the back of it and get it away from the tree. The city of Norman gets bid for me taking it away. What do you do with all that mulch? People don't take it away and they start charging us.
Thank you for the question. The question was, at present, mulch collection at the compost facility is free. And what happens if we start charging for that collection and people don't pay? Well, the as-is sales that I was referencing in my presentation are actually as-is sales to business buyers, not to individuals within the city of Norman. So these businesses do not pay for yard waste collection, whereas individuals within the city of Norman do. And most of what is collected currently by City of Norman residents is actually compost. It's not mulch. I was looking just at the mulch and wood chips. And the $2 price point that I identified was based on interviews with the businesses that are currently collecting it. That's what they would be willing to pay. So it doesn't affect individual consumers. Yes?
This question is for Castle. The company is about 3 to 4 years old, and they currently have, let's say, over 600 properties under management. Your strategy was to add 60 properties over a 2-year span. Why is this an effective strategy if they've been able to collect 200, 300 properties a year, and this will add 30 annually to the bottom line?
Yes. Thank you for your question. The question was, why do I think this is an effective strategy of adding 60 units over just a 2-year span when they have added 600 over the past 4 years when they have been open? This is simply a supplemental strategy to add units that is more of a passive strategy where the main part of getting it started is going to be in the beginning when they are going canvassing the different real estate brokerages and getting contacts with them. But once it's up and going and realtors know about this opportunity to gain additional income by referral method, then it's going to be more of a passive strategy to add units while they're also adding units directly by going out and facilitating their sales methods as they currently are doing.
This question is for Taylor and the Stephenson Cancer Center. So you talked about beefing up the Stephenson Cancer Center's social work program, and especially putting people in contact with hotel vouchers and free gas. But one of the examples you provided included a $700,000 savings for patients. How in the world can talking to a social worker save someone $700,000?
That's a great question. Thank you for the question. So how can a social worker save someone $700,000 was the question. And this is because what a social worker does is they screen through all of the patients and they assess the different needs. So if someone has emotional needs, they can connect them with a psychologist. And then if they need financial needs, they can put them in contact with the financial navigator, which they're for currently at Stephenson. Thank you.
Yes.
This is a question for Sonia. I saw that so when you're talking about these different locations and a lot of that money coming from operational costs, and so I was wondering if you could elaborate on what money you're pulling from and if pulling that money will affect your operations.
Sure, thank you. The question was, in my presentation, I mentioned that $219,000 would be needed for a third location, and then a bulk of this would be coming from current operational funds. The answer to that question is that a large majority of that is actually coming from the profit that SkinLab is already generating on a month-to-month basis, some coming from a former buyout that will no longer be a cost, and lastly, cash on hand that they could spare. Thank you.